pretty soon we can think about ODA becoming insignificant. And as it is insignificant if you look at the global numbers or even the country numbers. ODA is a small fraction of capital mobilization. It's private sector and taxes that are the big numbers. So how do we really get into the bigger game? Thirdly, I think accountability, impact assessments, and very serious impact assessment I think is important. And this needs to be triangulated by civil society and private sector and others. Thirdly, I think let's create incentives for performance, both for public but also for private partnerships. Let's create some clear incentives. Can counties be given clear incentives? And so I think this could even be as simple as financial incentives, but let's create some serious incentives for good performance. Number 5, let's take a long-term view. So I think there's been a lot of this piloting after piloting after piloting for 50 years. How do we ensure that we don't have islands of excellence in a sea of deprivation? How do we really roll out this kind of approach to 45 million Kenyans, for example? So I think we need to get away from this piloting mentality. Rules of engagement and disengagement, I think, which my colleague from MSD talked about, I think is also very important, because with private sector, let's make sure there's clear rules of engagement and disengagement. And finally, when we talk about leaving no one behind, I think there are pockets of poverty and vulnerability across countries that oftentimes will not lend themselves to bankable projects only. There will be some value chains and some investment opportunities in water and sanitation, nutrition, and the like, but not necessarily all the time. So how do we make sure that public funds go to more of the non-bankable areas which are really critical and attract private sector funds for those bankable opportunities in order that we optimize our resources as well? I think ultimately the main effort for us is to go beyond our individual branding, and let's look at this as a serious collective effort under goal number 17 to leave no one behind. Thank you.
Toyin, you have final word. What also educate themselves. You know, we've had a lot of pushback in Africa on teaching what I would just call it bluntly, sex education. So we've had to develop a new curriculum, which we call personal, social, and health education. I went to a university the other day, and I asked the girls, I think 500 girls between 18 and 25. And I just said, you know, simply, tell me which one of you knows about family planning and contraception. I was stunned. Not one girl put up her hand. In fact, I left the podium and I said, look, let's have a very straightforward conversation here, you know. You girls are in the, what do you call it when it's both sexes in one university? You know, the two sexes university, and you don't know about family planning contraception. It turns out some of them did know, but you know, they're scared to talk about it. And then even if they talk about it, they don't know where to get it. It's supposed to be in the primary healthcare center, but you have to pay for it when you get there. They can't afford it. So it's time for the world, when we're crafting our partnerships, to really look at the real simple problem on the ground and craft our partnerships around those. Look, the notes I have. GlaxoSmithKline have capped the cost of their drugs for the least developed countries to 25% of the price charged in developed countries. You have Saving Mothers Giving Life Partnership from Merck. You have Johnson & Johnson even helping Wellbeing Foundation on emergency obstetric newborn care skills. We're actually leaving labs behind in hospitals, in rural areas in Nigeria, and in every hospital where we've taught them how to clear, I mean, I give it a big name, emergency obstetric and newborn care skills, but it is clearing the airways, making sure the baby breathes. You have 8 seconds to do that, otherwise the baby dies. And where we have taught it, nobody has died. HIV, if you're strengthening health systems for HIV, it means every hospital has a lab. So you can test for malaria very quickly. You can check drug compliance on tuberculosis. I think it's time for us to actually say our problems as they are and to have funding mechanisms that are more like investor mechanisms. And my very last word is I want to disagree with Arif that primary health care is not lucrative, because I've been looking at a model that is marrying the cost of primary health, the scale of primary health, with health insurance. To take, you know, we've done something very similar actually with farm access before. We had a pocket of excellence in Kwara. In 3 years, we went to 200,000 people. Capacitation fee, $2.50. They got care. It's been taken over now by saving 1 million lives. So I actually believe a smaller investment at the front line saves you a bigger investment, but gives you a smarter investment later at the secondary and tertiary. So my dream is that every citizen is counted at birth. Every citizen is registered at birth so that that citizen exists. And every citizen is protected from the vulnerabilities that we know. We have the evidence. We know the vulnerabilities that occur. We know how they occur. The health promotion. I personally used to be scared of promoting health if I didn't have a solution. You know, I'm not somebody who will happily give you cervical cancer screening and then tell you you have cancer and, you know, I can't tell you where to treat it or you can't afford to treat it. So we need to start looking at health insurance and we need to make this available to all. It's mandatory. Then, for the politicians, and this is my very last word, for the politicians that think that primary health care isn't sexy. In Nigeria, we had an election. We overturned a sitting government by using technology, permanent voters card.
Yeah.
Those primary healthcare centers that nobody feels like going to in the bush, there are 22,000 of them. See them as health-enhanced voting centers.
Here.
And come and invest in
Thank you very much. Thank you. So I love panels where there is a bit of heat in the conversation, but I really hope a panel with good heat actually gives some light to the people in the audience. And so back to was this a sufficiently